Welcome back. My name is Dr. Carl Baird, and today I wanted to make a quick video explaining the most common cause of joint pain in adults as they get older. So this is a concept that I briefly mention in most of my exercise videos as a reason why we're picking certain exercises or why we're progressing exercises the way we are. But I did want to make a separate video highlighting the common cause of joint pain because it's such an important concept for anyone with joint pain to understand. If you can understand the cause, then you can help find better solutions. The other reason why I wanted to make this video is to help simplify the cause of joint pain, because most people that come into my clinic, they've tried physical therapy, they've gone to a medical doctor, they've gone to acupuncturists, who all have kind of separate causes and separate treatments of joint pain, all of which kind of provide temporary pain relief but fail to solve the problem. And so people get a little bit confused because they've been told all these things. So I'm hoping this video helps simplify the cause of joint pain so that you can understand why movement and strength training is the best thing you can do to solve joint pain, keep active, and maintain your lifestyle as you get older. So let's go ahead and get right into it. The most common cause of joint pain in adults is this equation: impact times time. So let's start with impact. Now, it's really easy to find the cause of joint pain when there's a big, huge impact, like a car crash or a fall down the stairs. You can easily point to say, I was in a car wreck, that put a lot of impact on my joints, and that's where my back pain came from. It's pretty easy. But that's not how most people or most adults' joint pain progresses. Most people, they can't really point to a cause. It gradually comes on, and then it gradually goes away, and it kind of comes and goes, and they can't really explain it. But as they get older, what happens is now instead of 6 months between episodes of back pain, it might start to become more frequent, or the pain might start to become more intense. And so to understand that, we have to understand that this impact is not a huge impact, but they're small, repetitive impacts that happen throughout the day. Again, you might not even notice that they're happening as you're performing them, but the more time that goes on, the more these impacts get compounded until a tissue can't take it anymore, whether it's your cartilage, whether it's your joints, whether it's your spinal discs. Eventually, enough of these small impacts will add up to a point where you'll start to experience pain. So that's really it. The most common cause of joint pain in adults as they get older is these small repetitive impacts compounded by time. So now let's start talking about the solution. So if we're looking at this equation, there's only one thing that we can change. So time, there's nothing we can do about it. Time marches forward, right? We're going to get older, unfortunately. So we have to start looking at impact. How can we limit the impact that goes through our body as we move throughout the day? And this is where most traditional treatments fail, because you can take pain pills, you can get injections, you can have surgery, you can get endless chiropractic adjustments, endless massages, and they're all going to help relieve joint pain, but they're going to do nothing to address this root cause, which is these small repetitive impacts. And so what that means is that you might get some temporary relief from these treatments, and most people do, but it's going to come back because we haven't addressed the things that are causing this impact on your specific joint. And so this is where we get into movement and strength training, and why I would argue improving movement and building strength is the best thing that you can do to solve joint pain, keep active, and maintain your lifestyle as you get older. So let's get right into it in terms of how to limit impact on the body for less joint pain. There's 3 things that we want to accomplish. And this is what, when I put these exercise programs for people, what I'm focusing on is how to limit impact through these 3 things. The first one, movement patterns, which is just a fancy way of saying how you coordinate movements to perform specific tasks. There's a right way and a wrong way to bend forward and pick something up off the ground. There's a right and a wrong way to sit down. There's a right and a wrong way to go up and down stairs. And that's what I mean by movement patterns. 2 is mobility. So all of your joints should have an adequate range of motion. And what can happen if we're too stiff or we don't have that range of motion in that joint is that your body is very smart and it will start to compensate. So the easiest example is in the hips, because a lot of people have stiff hips. What can happen if you have stiff hips and you're trying to do certain movements like a squat or even just sitting down, If you don't have that full range of motion in the hips, your body's going to compensate and you're going to sacrifice some of the stability in your lower back. And that means more impact goes through the structures of your spine, which over time is going to lead to pain. So that's why we want to make sure that all of our joints have adequate mobility. Lastly, and I would say most important, is strength. So ideally, we want our muscles to be providing the stability to support our joints. And what happens as we get older, we start to lose muscle mass, which means if we're not actively working to improve it, we're slowly losing it. And so if we're trying to do the same activities that we did when we were younger, that's more impact on the joints, which eventually will lead to pain and dysfunction. And the other thing I really like about strength training and why I harp on building strength more so than mobility and movement patterns is because a lot of the movements we use to build strength also help improve movement patterns, and if you do them enough, will also help improve mobility as well. So that's why I like to focus on strength. But so just to recap what we said here, the reason that we want to improve movement patterns, mobility, and strength is to help limit impact on your joints. And that is going to be the best way to solve joint pain, keep active, and maintain your lifestyle as you get older, because it's the only thing that addresses the root cause, which again is these small repetitive impacts compounded over time. So that's all I got for you today. I hope that explains maybe some of the pain that you've been experiencing and helps motivate you to get started on building strength and improving movement. So that's all I got for you today. Again, my name is Dr. Carl Baird. This is Solving Pain with Strength. If you have any questions, leave them in the comments below. I am happy to help. Thank you so much for watching. Hey guys, it's Dr. Carl Baird here, and I wanted to thank you for watching our previous video and supporting our channel. Now, if you're somebody who's looking to build strength to solve joint pain, keep active, and maintain your lifestyle as you get older, be sure to subscribe to our channel to watch all of our new videos. You won't find it anywhere else.